There is plenty of historical evidence of the brutal treatment of mentally sick people. Although it is simple to pass harsh judgment on early initiatives, looking back can help us maintain perspective in a sector that is constantly changing. Here are the 10 worst mental health treatments in history. Number 10. Bloodletting and Purging. Despite rising to prominence in the West starting in the 1600s, this treatment has its origins in classical Greek medicine. Claudius Galen held that unbalanced humor in the body was the root cause of disease and illness. Galen's writing served as the foundation for Thomas Willis's method of treating people with mental illness. He contended that mental illnesses were caused by an inherent biochemical link. It was believed that bleeding, purging, and even vomiting may assist to remedy these imbalances and treat both physical and mental illnesses. And not just mental disease was treated with these methods. Diabetes, asthma, cancer, cholera, smallpox, and stroke were presumably treated at the time via leech bloodletting or venesection. Number 9. Asylums and Isolation. Beginning in the Middle Ages, isolation was the preferred method of treating mental disease, which may help to explain why mental asylums proliferated by the 17th century. These hospitals were locations where individuals with mental illnesses might be kept, ostensibly for treatment but frequently just to keep them out of the public eye. Serious problems with overcrowding and unsanitary conditions in asylums sparked campaigns to raise awareness and the standard of care. Physical treatments for mental illness were commonly used at the time by medical professionals. This strategy resulted in the application of cruel techniques including freezing water baths and restraint. Number 8. Insulin coma therapy. Introduced in 1927, this procedure was used until the 1960s. In insulin coma therapy, the patient is intentionally put into a low blood sugar coma because the doctors thought that significant changes in insulin levels could affect how the brain worked. 1 to 4 hours may pass after an insulin overdose. After their blood sugar levels dropped, patients received an insulin shot that made them lose consciousness. Long-term coma was a risk, and the mortality rate ranged from 1% to 10%. Later, electroconvulsive therapy was developed as a less dangerous substitute for insulin coma therapy. A daily dose of 150 units of insulin was gradually increased until comas were generated, at which point the amount was stabilized. Sometimes dosages of up to 450 units were used. The dose of insulin was quickly reduced before the course of treatment was discontinued after 50 to 60 comas, or earlier if the psychiatrist believed that the maximal benefit had been realized. There are records of up to 2-year courses. Number 7. Metrazole therapy. Doctors used a stimulant drug to introduce seizures during metrazole therapy. A minute or so after the injection, the patients started having seizures, which could break bones, tear muscles, and have other negative repercussions. Typically, the therapy was given multiple times per week. The FDA banned the use of metrazole in 1982. Seizure therapy was the forerunner of electroconvulsive therapy even though it was risky and ineffectual. Notably, ECT is still applied occasionally to treat extreme mania, catatonia, and sadness. Number 6. Hysteria treatments. Women who experienced any type of mental disease throughout history were occasionally mistakenly diagnosed as having hysteria. Hippocrates, who introduced the term, thought that hysteria may be caused by a number of ailments, including fainting, nervousness, and muteness. Hysteria was thought to be treated by relaxing a woman's uterus. Patients received treatment that included advice to get married and have kids. Doctors didn't start to discover that hysteria wasn't really a sickness until the 20th century. They then started to recognize the true conditions, which included post-traumatic stress disorder, depression, and different phobias. Number 5. Lobotomy. The 1949 Nobel Prize in Physiology and Medicine went to this now outdated medical procedure. Although it was intended to interfere with brain circuits, there were significant hazards involved. Lobotomies, which were common in the 1940s and 1950s but were always debatable, were recommended in cases of extreme mental illness. The connections between the prefrontal cortex and frontal lobes of the brain were surgically severed or removed. 5 minutes would be enough to finish the process. While the symptoms of some individuals improved, the treatment also resulted in new limitations. Following the development of the first psychiatric drugs in the 1950s, the technique was generally abandoned. Number 4. Hydrotherapy. If the phrase hydrotherapy brings up pictures of Hollywood celebrities peacefully relaxing in luxurious tubs, then you definitely weren't a patient at a psychiatric hospital in the early 20th century. Using the rationale that taking a bath can frequently be soothing, Psychiatrists of yesteryear tried to cure various illnesses with comparable liquid remedies. For instance, patients who were overactive received warm, exhausting baths, while those who were lethargic received energizing sprays. However, some medical professionals were overly enthusiastic about the idea and began recommending treatments that sounded more like punishment than a cure. One treatment entailed wrapping the sufferer in ice, cold water, soaked cloths and mummifying them. Another had the patient stay submerged in a bath for hours or even days. On the surface, this would not sound too horrible, but the patient was strapped in and only allowed to leave to use the lavatory. And lastly, a few physicians prescribed the use of high-pressure jets. According to sources, at least one sufferer received a fire hose jet of water while being crucifixion, strapped to the wall. Hydrotherapy eventually gave way to psychiatric medications, which were typically more successful, as happened with many other extreme treatments. Number 3. Trepanation. One of the earliest known treatments for mental illness is trepanation. It involves drilling a hole in the skull with an instrument. A trepan, bore, auger, and occasionally even a saw were used to make the hole. Throughout history, this surgery has been carried out with many fatalities and severe injuries. Because it was believed that demons were to blame for mental disease or insanity, people received this treatment. These demons would be able to flee if a hole was made in the skull. Trepanation continued to be used throughout much of the 20th century. As better choices for treatment emerged, it was finally phased out. Even though trepanation is no longer performed in medicine, some people still adhere to the belief. Number 2. Electroshock therapy. It is also referred to as electroconvulsive therapy. Although ECT is being used today, it wasn't always performed under anesthesia and with the aid of a muscle relaxant. There is evidence that seizures were induced for the treatment of mental disorders as early as the 16th century. After being first launched in 1934, convulsive therapy quickly gained popularity and was applied on a global scale. Typically, patients received 10 to 20 sessions. Unfortunately, confusion and amnesia could result from the surgery. The operation is now seen to be significantly safer if carried out by trained experts. Number 1. Rotational therapy. Rotational therapy essentially involves spinning patients around while they are seated in chairs. Erasmus Darwin, Charles Darwin's grandpa, developed this bizarre procedure in the early 19th century. Patients who had mania or high levels of arousal were treated with it. Darwin hypothesized that excessive patient spinning would raise pressure and reduce brain congestion. Following that, Dr. Joseph Mason Cox created a method for rotating patients while employing a certain type of chair. Although there were no clear negative effects, rotational therapy quickly spread throughout Europe. However, patients claimed to feel less peaceful, at ease, relaxed, and good overall. Additionally, because the patient's head and body were coupled to a rotating machine in a dark chamber, Cox's chair was occasionally utilized in violent ways in psychiatric facilities. German psychiatrist Emil Kraepelin conducted research on the effects of rotational therapy on both healthy and mentally ill patients. He found that while mentally ill patients endured the experience for as long as 4 minutes, healthy patients begged for the machine to be stopped before 2 minutes had passed. Although Cox's chair is no longer in use, it prompted more research into the connection between mood states and the vestibular system. What do you think of our video? Let me know in the comments section below. If you enjoyed this video and want to hear from me again, be sure to hit that subscribe button before you go. Thanks for watching.